Drugs acting on autonomic nervous system. What is the autonomic nervous system? The autonomic nervous system, ANS, formerly the vegetative nervous system, is a division of the peripheral nervous system that supplies smooth muscle and glands, and thus influences the function of internal organs. What does it do? The autonomic nervous system is a control system that acts largely unconsciously and regulates bodily functions, such as the heart rate, digestion, respiratory rate, pupillary response, urination, and sexual arousal. This system is the primary mechanism in control of the fight-or-flight response. The autonomic nervous system is regulated by integrated reflexes through the brainstem to the spinal cord and organs. Autonomic functions include control of respiration, cardiac regulation, the cardiac control center, vasomotor activity, the vasomotor center, and certain reflex actions such as coughing, sneezing, swallowing, and vomiting. Those are then subdivided into other areas, and are also linked to autonomic subsystems and the peripheral nervous system. The hypothalamus, just above the brain stem, acts as an integrator for autonomic functions, receiving autonomic regulatory input from the limbic system. The autonomic nervous system has three branches: the sympathetic nervous system, the parasympathetic nervous system, and the enteric nervous system. Some textbooks do not include the enteric nervous system as part of this system. The sympathetic nervous system is often considered the fight-or-flight system, while the parasympathetic nervous system is often considered the rest and digest or feed and breathe system. In many cases, both of these systems have opposite actions where one system activates a physiological response and the other inhibits it. An older simplification of the sympathetic and parasympathetic nervous systems as excitatory and inhibitory was overturned due to the many exceptions found. A more modern characterization is that the sympathetic nervous system is a quick response mobilizing system, and the parasympathetic is a more slowly activated dampening system, but even this has exceptions, such as in sexual arousal and orgasm, wherein both play a role. There are inhibitory and excitatory synapses between neurons. In the nervous system, a synapse is a structure that permits a neuron, or nerve cell, to pass an electrical or chemical signal to another neuron, or to the target effector cell. Synapses are essential to neuronal function. Neurons are cells that are specialized to pass signals to individual target cells, and synapses are the means by which they do so. There are two fundamentally different types of synapses: electrical and chemical synapse. In an electrical synapse, the presynaptic and postsynaptic cell membranes are connected by special channels called gap junctions that are capable of passing an electric current, causing voltage changes in the presynaptic cell to induce voltage changes in the postsynaptic cell. The main advantage of an electrical synapse is the rapid transfer of signals from one cell to the next. In a chemical synapse, electrical activity in the presynaptic neuron is converted into the release of a chemical called a neurotransmitter that binds to receptors located in the plasma membrane of the postsynaptic cell. The neurotransmitter may initiate an electrical response, or a secondary messenger pathway that may either excite or inhibit the postsynaptic neuron. Chemical synapses can be classified according to the neurotransmitter released: glutamatergic, often excitatory; GABAergic, often inhibitory; cholinergic, such as vertebrate neuromuscular junction; and adrenergic, releasing norepinephrine. Because of the complexity of receptor signal transduction, chemical synapses can have complex effects on the postsynaptic cell. Autonomic neurotransmitters. All preganglionic autonomic neurons, both sympathetic and parasympathetic, use acetylcholine, ACH, as their fast excitatory transmitter. Most sympathetic final motor neurons utilize noradrenaline, norepinephrine, as their primary transmitter, together with co-transmitters such as adenosine triphosphate, ATP, and peptides, including neuropeptide Y, NPY, galanin, somatostatin, or opioid peptides. Some sympathetic final motor neurons, especially those innervating sweat glands, use ACH as their main non-peptide transmitter. Parasympathetic final motor neurons pathways usually use ACH, nitric oxide, or both as non-peptide transmitters, as well as a wide range of co-transmitter peptides including vasoactive intestinal peptide, VIP, calcitonin gene-related peptide, CGRP, somatostatin, and opioid peptides. No parasympathetic neurons use noradrenaline as a transmitter. The drugs that affect the ANS are divided into two main sections. They are the cholinergic drugs and the adrenergic drugs. Some of these drugs are agonists, which means they bind and activate a receptor to produce a biological response. Others are antagonists, which bind to receptors and block normal responses. Let's cover the basics of the cholinergic drugs first. Cholinergic drugs. Cholinergic drugs are those that affect the receptors that are normally activated by a natural biochemical found in the body called acetylcholine, ACH. The cholinergic receptors are themselves divided into two main types. One type is called the muscarinic receptor, and the other is called the nicotinic receptor. One cholinergic drug is bethanechol. This drug is a cholinergic agonist, meaning it stimulates muscarinic receptors. One of the consequences of this is the stimulation of a certain muscle in the bladder that contracts in order to expel urine. In cases where the bladder isn't contracting, bethanechol can be used to help a person urinate. The flip side to a drug like bethanechol is a drug like atropine, which binds to the muscarinic receptor but doesn't stimulate it. It also blocks the ability of acetylcholine to bind and stimulate the receptors. That's why it's known as a cholinergic antagonist. Atropine can be used for many functions, but is most famous for dilating the pupil when applied topically to the eye. This helps your eye doctor examine the inner depths of your eye while shining a light into your eye at the same time. Had atropine not been applied, the pupil would have constricted in the response to the light, and the doctor would have had a hard time seeing inside. Adrenergic drugs. Adrenergic drugs are those that act on receptors normally stimulated by two biochemicals called epinephrine and norepinephrine. Drugs of the same name are often used in medicine. Epinephrine is an adrenergic agonist, meaning it binds and stimulates adrenergic receptors. Epinephrine can be given for a wide variety of reasons. For example, epinephrine not only increases heart rate, but also strengthens the contraction of the heart muscle. Epinephrine may be used to restore a person's heart rhythm during cardiac arrest as a result. The administration of epinephrine also results in a powerful widening of the airways of the lungs, bronchodilation. Thus, it is a drug that can be used to counteract the life-threatening effects of a serious bronchospasm in people with a severe response to an allergen, like peanuts. Pharmacodynamics of adrenaline. Adrenaline directly stimulates all the adrenergic receptors both, and brings about effects of sympathetic nerve stimulation. Pharmacokinetics of adrenaline. Adrenaline is rapidly destroyed in the gastrointestinal tract and oxidized in the liver. It is therefore ineffective when given orally and should be given intramuscularly or subcutaneous. Intravenous injection is highly dangerous and is likely to precipitate ventricular fibrillation. The drug may be given by nebulizer for inhalation when its relaxing effect on the bronchi is desired, or it may be applied topically to mucous membranes to produce vasoconstriction. Extensive metabolism of the drug in liver, little is excreted unchanged in the urine. This is about drugs acting on autonomic nervous system. Thanks for watching. If you like this video, please like the video, and welcome to leave a message. You must be my biggest motivation to make the video. Please subscribe to the channel, where you'll find more and more medical videos here later. Thanks.